Hello, my name is Dr. Philip Mease. I'm the Director of Rheumatology Research at Providence Swedish Medical Center and conduct a clinical practice at Seattle Rheumatology Associates. I'm honored to be here today with a nurse practitioner that I work with, Cayla Alexander. And we're going to be talking about a patient with lupus who underwent CAR T cell therapy for her disease. Cayla.
Hello. So today we'll be talking about Sue, a patient at our clinic who underwent CAR T cell therapy for lupus. And Sue is 38 years old from rural California. She was diagnosed with lupus in 2017 with pretty classic symptoms of arthritis, rash, oral ulcers, fatigue, and then had a positive ANA and DNA antibodies. Initially, she was treated just with hydroxychloroquine and prednisone, but several years later, in 2021, there was a significant escalation in her disease activity, specifically in regards to kidney involvement. So at that time, treatment was intensified with combinations of methotrexate, mycophenolate, belimumab, and then after renal biopsy showed class 3 and 5 changes, therapy was escalated further with IV cyclophosphamide. And that is when she presented to our clinic with labs at the time showing a UPCR of 1.68, 24-hour urine protein over 2200, high titer ANA and DNA antibodies, low complements, and a very high SLEDAI score of 26. And interestingly, how she learned about CAR T therapy was actually through a TikTok video that an ER doctor had posted. And she had the industriousness and resourcefulness to figure out how to find Dr. Mease 2 states away and came and presented at our clinic because of this TikTok video she'd seen and what she had subsequently learned about CAR T from her own reading. And the reason she was able to do this, to complete CAR T, was because of the community around her. She's a special education teacher and has 4 of her own children. So her husband and both sets of grandparents who also live in the small town stepped in to take care of the household, and the community of her small town and her school came together to cover for her and make sure that she would be able to do this. And it's a lot that's required with the screening and eligibility visits, every in-person visit to Seattle requiring flights and hotel stays, and the treatment process itself. Essentially, she had to move to Seattle for almost 2 months. And after that, monthly visits are required for 6 months, and then visits every 3 months for 2 years, and then longer term monitoring for 15 years. But her community really rallied around her to support her success, and she was able to complete treatment.
So that was a wonderful summary, Cayla, and exemplified the fact that she had really significantly worsening disease, would have had likely early mortality from her progressive kidney disease. The fact that she had already tried and had inadequate response to a number of different immunomodulatory medications already, and now was requiring IV Cytoxan and steroids and so on. So what was the procedure that she went through when coming to Seattle for CAR T therapy? So first of all, there's the screening to make sure that she's an eligible patient, and she certainly was. Then we had to schedule an apheresis procedure where we drew off many of her cells and then isolated T lymphocytes, sent them back to the sponsor of the study's manufacturing plant, where the cells are engineered to express CD19 receptor on the cell surface of the T lymphocytes, which would then allow the T lymphocytes, when reinfused in the patient, to identify, hunt down, and ablate all of the pathogenic CD19 positive B cells that were present in her. So she went through this apheresis procedure, and after a few weeks of the manufacturing, where the T lymphocytes are exposed to a lentivirus that leads to a change in the DNA in the cell and then expression of the CAR. The cells were shipped back to us, and then she was hospitalized to receive 3 days of a conditioning regimen of Cytoxan and fludarabine. And then she received the cells. She tolerated that very well. The only cytokine release syndrome side effect that she had was 2 days of fever and she was treated for that with Tylenol on the first day and then a single infusion of tocilizumab on the second day. And that was basically it. There were no other issues that arose during the 2 weeks of observational hospitalization that she had. Then she had to be in our vicinity within an hour's drive for 1 month after the hospitalization. She stayed in a local hotel. She had her husband would come up, or one of her other relatives would come up and be with her. And we saw her frequently during that period, and she did very well. Now we've been observing her out over the course of a year. And what has been remarkable has been the fact that her lupus symptoms have essentially gone away. Really rare occasion where she has a mouth sore or a little bit of rash, but her kidney disease has really stabilized and improved. Her DNA antibody has gone way down. Her complements have normalized. And she has not had any adverse effect from the point of view of infection. She did have a period of low white blood cell count and lymphocyte dropping. That is expected. And now she has been reconstituted with what are called, what we would call normal B lymphocytes. And we are hoping for observing a long-term remission, as has been seen in the pioneering studies that were done by Georg Schett's group in Erlangen, Germany. But even if there is some recurrence of disease, what we're observing is that it tends to be less severe and more easily treated. And thanks to the significant supportive community that she had, she was able to undergo this procedure that is literally life-changing for her. And it was a delight to be able to work with Cayla over the course of this patient's experience to co-manage her together, along with our colleagues in the hematology oncology division at Providence Swedish, who have had a lot of experience with CAR T-cell therapy. And so we're working side by side with them to monitor both safety and efficacy throughout the procedure. So thanks very much for listening in on this example of a rheumatologist working together with a nurse practitioner and working with CAR T-cell therapy in lupus.